Hi, my name is Sumara Mahindra and I am the founder of Kera, an integrative oncology company. You are about to watch an in-depth conversation with two incredible people, one healthcare professional who is country renowned and the other who is breast cancer thriver. This conversation is brought to you by StarHealth Insurance and Kera to give you all the information out there about breast cancer, keeping your risks low, or if you're going through breast cancer, how can you recover and heal from it. We hope that this information brings a wealth of knowledge to you so you can take the steps and make the changes in your life to heal and live better. Enjoy.
So here we are again in this in-depth conversation for Breast Cancer Awareness Month, October. Star Health and Carer is privileged to have Dr. Sidharth Sahni, a regular in a lot of my interviews. Dr. Sahni, it is a pleasure for you to be here. You bring so much light and understanding about cancer and breast cancer, and today I want all the people out there who are going to watch this video and really understand what breast cancer is all about, the misconceptions behind it, and what they can do in their lives if they are afflicted by the disease, recovering from it, or want to prevent the risk of breast cancer. So thank you so much for being here today.
Thank you, Samara. It's always a pleasure.
And of course, Megha, you are, I'm going to call you, of course, a breast cancer thriver. You have walked the path of this journey, and it's very important for someone like yourself to be present over here, share your story with all of us, and all those out there who are going to watch this video and be inspired and actually learn from the experience of someone who's gone through this and now come out of it the other side. It means a lot for me personally, and I'm sure for many people out there, that you are doing this for us. So thank you so much for being present in this interview.
Thank you for having me, Samara. I'm quite excited to do this.
Let's talk about the various things that we don't speak about and that we all from our different journeys experience, and so that maybe it can kind of shed some light into a lot of misconceptions out there. So just starting with you, Dr. Sahni, I'm going to start off by asking you, what is the biggest myth that you have come across about breast cancer?
I think the biggest myth is the fact that every time a woman gets diagnosed, she can't believe that she's got it. And the biggest myth is that if I don't have a family history, I can't get breast cancer. And that used to, if you look at statistics today, only 10% of breast cancers that are diagnosed every year internationally have a history of any sort of cancer, breast, prostate, ovary, whereas 90% are just random events. So if you look at, for example, India today, the incidence of breast cancer is 1 in 10 women, especially in the metros, will get a breast cancer in a lifetime. Now, consider the fact that I've been practicing this in India for the last 16 years. And when I started, this risk was estimated at about, depending on who you spoke to, 1 in 32 or 1 in 28. And in a 15-year period, it's gone from that to 1 in 10. And when I started, on a lighter note, when I started practicing here, people used to tell me, why don't you do other surgeries? You must have been trained in at least doing a hernia or a gallbladder or something like that, because agar sirf breast surgery karega to bhukha marega. Unfortunately, I am not starving, and that's not very good news for our nation. The World Health Organization has also written up a paper which says that by 2025, this 1 in 10 may well go down to a 1 in 7 or a 1 in 8. So it's just increasing with rapidity. We also used to, when I was working in England, we used to look at a clinic list, and we really get worried about the 45, 50 or 50 plus, 55 plus age group, and really look at the cancers. And then the younger ones, we were fairly aware would not have anything. But today I can tell you that the youngest I've treated for breast cancer is unfortunately 23. and the eldest, of course, is 92. So that's the age range. And when people ask me what's the biggest risk factor involved, the biggest risk factor is the fact that you have breasts. So if you have a breast and that breast has the same amount of estrogen level in it pre and post menopausally, you can at any time trigger off. Of course, there are many trigger factors, and one of the most recent papers published, and it's been presented at ESMO in Madrid recently, is the fact that now even PM levels of 2.5 or more are a direct causal relationship to breast cancer. So it's now even the air that we breathe, so that can lead to breast cancer. So but as you said, the biggest myth, I can't get it.
So powerful, Dr. Sahni, because we experienced that ourselves through Cairo, where so many women believe that it's kind of more a genetic disease and genetic predisposition. While that is the case, as you mentioned, the percentages are not what people imagine it to be. So then this takes me to my next question is, then how do we keep our risks low, right? I live, and I believe you do live in a city that has so much air pollution. So what can we do?
I mean, we can be, of course, I have tried to be, and currently am also, be vocal proponents of sort of the right to breathe clean air. I think we need to keep stoking that movement. But the other things that are very key in trying to, you can't really prevent it, but even you can try and prevent it. So one is obesity, central fat. Tata did a very interesting study in their own breast clinic where they said, we'll look at how is the obesity distributed? Is it central or is it more on the hips and thighs? The pear-shaped versus the round tire. And they actually found that the women with central obesity had a 3.8 time greater risk of developing breast cancer than if they had fat around their hips only and buttocks. So we all like, men like women who have a flat waist, and so do women. You girls go crazy over guys who have six packs and things like that. It's a very primitive instinct in our brains, which tells us that if this person is like that, then they are bound to be healthy. All right. So when you exercise, how you look is a side effect. It just happens. So people who exercise to stay healthy are in far better shape than people. And we have to make a conscious effort to do that rather than just hope that genetics will take care of it. The second is diet. And particularly in diet, if you look at the National Institute of Health in Bethesda in America, and if you draw a line and look at the almost linear explosion of breast cancer, you go back 10 years or 15 years, and you'll see that is a mirror image of the fast food industry. Even in India, till 2003, till that this processed food industry was taking root, there was breast cancer, but it wasn't alarming, and it's gone. The better a fast food company does, the worse are the health outcomes. Third is avoiding white sugar and white sugar products. We are glucose producers, manufacturers. We are not glucose go downs. The fourth is the oils that we eat in. And that again brings me back to the fast food industry. So refined oils are poison for our body. And commercially, unless you really go to a great French or an Italian restaurant, everybody, including the 5 stars, everybody uses refined oil of some nature. There are only 8 oils worth cooking in or eating food in. Desi ghee is one of them, white butter. I'll just name them for people who want to know. So it's desi ghee, white butter, extra virgin olive oil, avocado oil, sesame oil, coconut, groundnut, and mustard. These are the 8 oils that are safe as hell to eat in. Another thing people ask me is extra virgin olive oil is only meant as salad dressing. It's not. There's no, having trained and worked in Italy, you cook in it. No respectful Italian household will ever cook in anything else. But Italian cooking is not done on high heat. They do it on very medium to very low heats. which is what they can take. Whenever they need the temperature raised, they use butter, or they use clarified butter, or they use avocado oil. So so these are the things that we can do, small things that we can do to prevent not just breast cancer, but most non-infectious diseases from setting in.
Yeah, exactly.
But exercise is also vitally important. All right, that you can't, that fat that collects in the center, it produces the most noxious chemicals that can damage anything and everything. So that's why it's important. But saying that, not all people, and I've audited my practice for the last 16 years. 73.2% of my patients, and I have a fair number by now, 73.2% of them have a BMI of greater than 25, which is going towards overweight and obesity. Okay, it doesn't mean that nobody who's under 23 doesn't have it, but the glaring population is obese, and that plays a huge role.
Absolutely. And that takes me to Megha. Megha, I'm very curious to know, did you think that this breast cancer could happen only for genetic predispositions, like Dr. Sahni said? What was your experience? We would love to know your journey about breast cancer and you being diagnosed and what you went through.
Sure. So, I mean, I had actually run a marathon in 2015, and it was the Pinkathon, and they'd shared a lot of material about breast cancer. And I read it solely from the perspective of like my mother and my aunts, because they were all above the age of 40. And I think that's when I realized that it need not be just genetic, but again, it was all targeted for women of the age of 40. So when I was reading that, I definitely didn't think that it would be a risk factor for me or something I needed to consider for myself. And about, I think, 2 years later, I felt a lump in one of my breasts while showering. And that's when I think because I'd read so much, it didn't feel normal. And I went to the GP, and she was like, oh, it may be a fibroid, and, let's just wait till your next period. But as I was walking out of that clinic, she was like, wait, why don't we get a sonography done? And that's the reason why I share my story, because I'm like, if she hadn't changed my mind, because she's like, it's not a risk factor for you at such a young age. But literally, I was at the door and she called me back and she's like, let's just get a sonography. And from the sonography onwards, it was a different story. I needed a mammo, which said it was a 50 to 90% chance I had cancer. I got a biopsy done and that confirmed it was cancer. So I got a lumpectomy. I had 20 rounds of chemo, 20 rounds of radiation, and have been on hormonal treatment since then. So yeah, that's pretty much my journey through the diagnosis. And I was just 25 when I felt the lump.
What made you go? Because majority of cases and majority of women your age, including myself, would probably not have taken that initiative to even go and get herself tested or checked by a gynecologist, because lumps are very common, right, in the breast.
Yeah.
So was it, was it just your experience, doing these pinkathons, or just being more open-minded to listening to the information out there? What really prompted you to do this?
So I think with the material I'd read, because I'd read a decent amount, I was aware that it doesn't feel like a normal one. So that kind of prompted me to just go get tested. Obviously, when I walked into that room, I had no, even a 1% doubt in my mind that it would be breast cancer. And also, I think my body was giving me symptoms. I was coughing regularly for 2 months, about 3 months before I got diagnosed. And I kept going to the GP, and then he was like, obviously, he tried his best. He did a chest X-ray, etc. Nothing came up. In fact, he did get his female assistant to do a breast exam as well, and she couldn't feel a lump at that point in time. So I guess it was also the background that I had seen doctors. I was trying to resolve why I was coughing for so long, and also all the material I'd read is and I'm someone who likes to go and find an answer, because if my body is not feeling okay, I'm like, the doctor needs to tell me why.
Honestly, but Dr. Sahni, do you see a lot of this where youngsters do kind of make an effort and come forward?
They have started, but which brings me back to the point of something which is so important. Doesn't take more than 10 to 15 seconds. There is no cost attached to it, and it's called self-breast awareness. It should be taught to every college-going student. I just gone to the US to drop off my son. So in the college dorms, every Cosmopolitan, Vogue, everything that's there, they have some something or the other about, breast cancer factoids, etc. So you're sort of sensitizing people from that age and age group. By 21, our body's development is complete, which is why the 21st birthday is such a sacrosanct birthday, because you have reached the peak of your development. And I think every woman from the age of 21 onwards should do a self-breast awareness, not a self-breast examination, because we don't expect you to find lumps. But what we want you to know is what is normal for you. I mean, all you girls can look in the mirror in the morning and find, oh, there's half a blemish on my face, which wasn't there. So I went out in the sun for 3 minutes longer than I should have. And people have carried out various forms of trials, and the doctors can only find the best hands. This was done in the States. About 38% was the accuracy in breast surgeons. And when women start doing it themselves, it takes, like I said, 15 seconds in the shower, right hand, left breast, left hand, right breast. Use the tips of your fingers, just go around in circles. Just teach your brain, this is normal for me. And for women who are having periods, it should be done preferably day 10 of the cycle, day 1 being the day the periods start. We've all got smartphones with various apps that we can put timers on, etc. for everything. Best done in the shower, because that's the one time you'll be alone and you'll be undressed in any case. So you don't have to make the extra effort of locking the room and then trying to examine yourself. Nobody, especially women who are working, nobody really can find time, because first comes the husband, then come children, then come the parents, then come the in-laws. I find that really sad, but that's the fact of life in this country. So if you're used to doing it at 21 and you're regular about it, you will go for a mammogram at 40. Right? You're very right. Most of the material published out there is for 40 plus, because that's still where the bell curve is at the most populated. But even then, women don't want to go. The rate of mammography screening by mammograms in this country is less than 2%. And it is so sad that none of the health insurance companies insist. I mean, when I go get my term insurance done for life, they make me go through, I don't know how, a gigantic series of tests just to prove that I won't die tomorrow. But if I go for my health insurance, nobody asks for a test. So it's not a health insurance, it's an illness insurance. It's an assurance that if you get ill, we will pay for you, but we will not in any way encourage you to be healthy. So, it's just things like that. And it's again a test which takes once a year, takes 10 to 15 minutes to do. It's not very expensive. And, when you said myths about breast cancer, there's another one, that mammogram has too much radiation. It's got less radiation than this blessed thing gives me in 24 hours. Okay. So, and I know that for a fact, because I remember I was doing a sentinel node biopsy when I was at Apollo, and this is a good 7-8 years ago. And my phone was lying next to the Geiger counter, which tells you if you found the node which is hot. So it detects radiation. And that instrument went ballistic till the phone was removed from theater. Okay, so and the iPhone is the lowest form of radiation in any smartphone. So you can subject yourself to constant radiation from this, but you can't get a little bit of radiation which actually saves lives. So that's another myth busted. But if you're not self-breast aware, you will not go for a mammogram. It's like getting your lipid profile done after you had a stroke or a heart attack. Wo to doctor karayega hi karayega. So, get it done.
Yeah, absolutely. Megha, because you had some, like Dr. Sahni said, that awareness is so important. And because you had some level of awareness, you actually took that step and got yourself checked. What happened after that? What happened when you were given that diagnosis? And as much as you would like to share, what was your journey like?
Sure. So like I said, I got a sonography done. The sono said I needed a mammo immediately, and the mammo confirmed it would be 50 to 90% chance it was cancer. And then I got a biopsy done the next day. So when the biopsy results came, and I remember my mother sitting down next to me and crying and saying, "Beta, it's malignant," I somehow breathed a sigh of relief, as strange as it may sound, because I felt something and my body wasn't feeling okay. Now they're going to get the lump out and I'm going to feel okay, right? Like that's literally the mindset with which I went into it. And I think because of that mindset, my surgery, I had a lumpectomy that went off well. There was obviously a series of tests. There was a PET scan, etc. before the surgery. That wasn't obviously fun, but like went through all of that, got the surgery done. And like I said, I went in with a very positive mindset because I'm like, there's a lump, it's going to get operated on, and I'm done. Like words like chemo, radiation didn't even strike a bell. I remember my boss checking with me saying that, "Oh, have they told you what next?" And I'm like, why are we even thinking about what next? Because I don't think in my mind I'd contemplated that chemo is something I needed. And luckily, there was no family history, so I don't think I'd fathomed how bad cancer can get, right? I just thought of it as a lump and not as like the C word that everyone dreads, which will come with chemo. But once they operated on me and they tested the lump, they realized it was 9 on aggressiveness. So they said that I would need chemo. That's something I didn't take well. That it was a bit hard hitting. That took a lot of, I would think it took months of acceptance, really. But after a lot of resistance and then doctors really making me understand why I need chemo, because I was like, if they've gotten the cancer out, why would you need chemo, right? But they made me understand that in a young case, the chances of it coming back are higher. Which is why then we went ahead with chemo. Chemo was like I said, 20 rounds, ideally 8 rounds, but 4 rounds were split into like 4 smaller rounds. So it I hadn't accepted it. The idea of losing my hair was scary. The idea of sitting at home and maybe perhaps being impacted, like my career being impacted, was scarier perhaps. But like I said, like it took me a few months to accept. When I truly accepted that this is what it needs, it became more bearable and it became easier. And then after chemo, I underwent radiation. Radiation was far easier in comparison to chemo. And it could manage office around radiation as well, so that was fine. And then I've been on hormonal therapy ever since. So it's been about 5.5 years of hormone therapy. So chemo, like I said, I think that perhaps was the toughest part of treatment. The first 2 or 3 were miserable, but then I got a really good nutritionist. So I realized how much food can play a role. Like Dr. Sahni mentioned, like sugar is so bad for you. The kind of oil you're cooking in is also so bad for you. And generally, like as an Indian household, everyone is coming home with concern, telling my mother that, okay, why don't you give her paneer? Why don't you give her eggs? It's barley. Why don't you give her XYZ, right? And obviously, as a mother, she was trying to incorporate all into my diet, as a result of which I was just feeling miserable by the end of the day. But having a good nutritionist guiding us through what I needed, depending on how I was feeling, because some people have massive constipation after chemo, some people have massive nausea, etc. So depending on my symptoms, they charted out a food plan, and that I saw a significant difference. I could, in fact, like I think once I started following the diet, resume office for 4 or 5 hours a day, a few months into chemo as well. So for me, that part of like apart from treatment, that part of alternate treatment played a really important role in like bouncing back.
What are some of the myths that or let's say that you believed prior to a diagnosis that has completely changed your perspective today?
Myths in terms of cancer is not a death sentence, I think, like to start with. Like when I think perhaps when people tell you when you're diagnosed that, oh, it's the easiest form of cancer, it's not fun to listen to that. But genuinely, I feel like the treatment is bearable, and if you find the right mechanisms, right people, like I said, nutrition, and set of people who are around for you and love you, I think it's all generally something you can recover pretty well out of. So the idea is just not to get scared, because again, like Dr. Sahni mentioned, sadly it has become far more common than we may like. But the C word, like everyone calls it, it's so dreaded. But beyond a point, if you just accept what it is and want to fight it out, it's very doable, I think.
No, it's wonderful to hear, Megha. And Dr. Sahni, why is I hear this as well. Everyone fears, in fact, the treatment more than the cancer itself. What can we do about this? Chemo is this dreaded word, like Megha is saying. Why is this so? I understand the side effects are quite drastic, but what's the deal here?
I'll answer it in 2 parts. First of all, people don't understand. I don't have a knowledge. It's like a child. And I give every patient who's willing to listen this analogy, that if you take a little child who's happily playing on the bed at night in your bedroom and you shut the light, what's the child's first response? they start howling. Why? Because it's fear of the unknown. It's the same with cancer. When people don't know what cancer is, they just have those myths, as Megha said earlier. The first thing that comes is uh, either death or treatment nahi lena. And you have to explain to them why they need what they need. And people have to understand that yes, chemotherapy is not the most pleasant things to take, but when it is indicated, it is necessary. The drugs that we have now are evolving at the rate of knots. I mean, we didn't even have a majority of them till a decade ago. But what we've actually got very, very good at doing is battling the side effects. So we practically have patients who hardly ever experience any nausea, vomiting. When I started, I've now been involved with breast cancer at various capacities for the last 30 years. So I've seen the change in when I started, and I started in England. And what we do now, I feel that we were barbarians back then. And, everyone, the rate of infection-related admissions from chemotherapy was close to 75% of the patients. Today, that rate, pretty much anywhere in the world, is less than 2. So less than 2% of patients are admitted with for chemo-related infections. And hair loss, yes, we're trying to battle it with things like cool cap, etc. But I suppose if you do study Dr. Hope Rugo's Stanford paper, where she used the cool cap on her patients, you will find that she hasn't given a breakdown of what was the skin type or what was this hair color type, or which responded better and which ones didn't respond better. So, I mean, there are attempts being made, and I'm sure they'll get better with time. But when I I think it's about giving hope to people, because I tell them, there are often people with comorbid conditions such as hypothyroidism or blood pressure or diabetes. And I tell them, I said, look, you've got these, you're very happily taking the treatment for these, but please remember, nobody can ever cure these conditions. But if you take the right treatment for breast cancer, we can cure you. I mean, today, early breast cancer across all subtypes, the 25-year disease-free survival rate is upwards of 95%. I mean, that's incredible. When I started 30 years ago, the 5-year survival rate of stage 1 cancer was 80%. And today we're talking of 25 years plus disease-free survival. So yes, just like any condition, whether it's an infection, whether it is your other blood parts of your body going wrong, require attention, treatment. And chemotherapy is so misunderstood. I mean, it's 2 Greek words, chemos plus therapia, which actually just mean drug treatment. For what reason the world of oncology has suddenly self-patented this term for itself? I mean, me prescribing you a paracetamol is also chemotherapy, theoretically. But that everyone's happy to take, but no one's happy to take the drugs that are required to keep, because I tell them, when we operate, the cancer is removed. The other treatments, the adjuvant therapy, the chemo, the radiation, is given so that the cancer can be kept at bay for the next 25 years, 30 years. So, you fight the battle once, but it's a question of spending time with your patients, understanding them, making them aware that you're always there for them, answering whatever questions they have, because then they start coming out with the, oh no, but I've also heard this, oh no, but I've also heard this, oh no, I've also heard this. So, you've got, as a doctor, I think that's your duty, that you not only, and I say it very freely to my patients, the difference between me and my butcher is that he's very skilled at dissection, but I'm there to manage you as a whole human being and not just to cut things out. And I think if you do that, people listen. And a lot of them, by the majority of them, have told me, once we heard you and once we took what you said in, I'm not feeling that scared. And as Megha said, very often the family members will come and tell me, don't tell her, she won't be able to deal with it. And by the end of it, halfway through the treatment, it's the patient who's telling me, look, I'm handling the emotional problems of my husband or my daughter or my, I mean, I'm looking after them instead of them looking after me. So you also realize how strong you are as a human being once you go through this. As Megha said, I mean, you find the strength. It's unreal. It's unreal. And I've seen it for 30 years. It's just fascinating how much inner strength all of us as human beings have, and how we can draw from it when we need it.
Yeah. So then where's the shortfall? What's the problem? Because we are nowhere close to where we should be in terms of awareness, in terms of being proactive to health, in terms of doing our screening every month. Is it lack of awareness? Is it just the
I mean,
health institute not encouraging it? Where
so,
are we?
so nobody who's I think anybody of import um, has come out with a success story. If you look at, I mean, Kylie Minogue, she was at the top of the tree when she declared to the world that she had breast cancer. She fought it. She came back. Sheryl Crow, Nicole Kidman about her mother, and then they are so. I mean, Glenn McGrath with his wife. He's got the Sydney Test match is now a pink test. And everybody knows the reason why it's a pink test. We, on the other hand, are not prepared to come out. I think it's a societal thing. We need more advocates from within the. I mean, what are the two biggest things in our country is cinema and cricket. So unless these two wings come out in support and say, fine, if we are playing at home, we will decide in October, for example, here, you've had the ability to at least light up all the stadia once in pink, as awareness. That itself is such a huge awareness creator. Who's done it? I saw something very, very, very heartwarming. I was out for dinner last night and we're coming back home. And it was so nice to see that the whole of the Taj Mahal had been turned pink for the evening yesterday. So at least, even if somebody doesn't know and they sit and ask and say, why have they done it? Somebody can tell them that this is Breast Cancer Awareness Month. So we need people to come up. We need people to encourage people to go for their screenings. I think that's because there is, and we need to really raise the level of noise regarding how bad it's becoming. I'm so glad to hear that StarHealth Insurance has taken out this initiative. And one of the things I can implore health insurance companies to do is when your renewal comes up, please ask for a mammogram from your patients. Otherwise, don't renew, or renew, but at a much higher premium. So, so these are things that you need to be encouraged in England. If you take a private health insurance, as a woman above 50, you will not have it renewed if you don't submit your annual mammogram screening test. So, it's sort of like a deterrent. So, I mean, there are so many levels that we need to focus on to be able to raise this awareness about breast cancer.
Megha, where's the shortfall according to you? Like, where do you feel that we need to kind of gain more awareness, or what do we need to do?
Yeah, I think apart from what Dr. Sahni mentioned, like from my personal experience, because, like there have been people who I've not been in touch with over years who reached out to me saying, oh, my mother felt this lump and perhaps like felt it a year ago and didn't do anything. So I think there's a lot of fear. So there may, I think awareness is picking up, like Dr. Sahni mentioned, people are turning things pink, or like if you go to certain stores, which are primarily, for retail brands, there is a little bit of awareness about that. But I think it's also the fear. And like, again, what he mentioned is that I think you need more perhaps survivors to make it sound like it is very manageable today. There is, adequate medicine and alternate treatment to make it very manageable. So because I feel a lot of women that I've spoken to live in the fear as a society that, okay, one, the diagnosis itself comes at a certain tag, which the family may not be okay to share about. And two, also that it's like, their life is over, right? In fact, again, and I wanted to add that in terms of how important it is to find the right doctor. I remember after when I was told I needed chemo, I went to one oncologist. And with all due respect to him, he said, forget that, you'll have a life for 6 months, forget about your career, forget about everything. And that scared the shit out of me. And I was like, okay, I don't want chemo because I want my career and I want a life. I'm not going to just 6 months give up my life, right? Then my family went to the other onco who I finally, got treated by, and she sat them down and basically said that everything there is a way out, right? We did opt for the cold cap. I did lose most of my hair despite the cold cap, but that's a separate story. But at that point, that's what I needed to hear, that, okay, look, we can salvage your hair. We can, work around all the side effects. You will be able to go to office. And I was able to go to office. So all the problems that I had, hair fall, career loss, losing out on a life, everything in terms of, because he had said you'll have infections, you can't see people, but I had friends coming over every day. I think that communication needs to be there, that today, especially for a breast cancer diagnosis, everything is manageable. You're not going to lose out in your life. So one is awareness, one is that getting rid of that fear, that God forbid, should that come to you, it is something that you can beat for sure.
In terms of raising awareness, all these female stars who are above 40, you don't need to come out. All you need to do is just get a picture clicked of going for your annual mammogram, or or if you're younger than that, taking your mother for hers or your mother-in-law for that. It makes a huge difference, so that, and we're not, I know it's biting into your private life, but when you're such a public figure, does one really have a private life?
Yeah. But what happens in these situations, Dr. Sahni? Like Megha said, I mean, she had such a horrendous experience from the clinical point of view, and I've come across stories myself. And then, of course, even a misdiagnosis that happens, that can also be quite worrisome. So, yeah, what are your points of view?
It is, and please remember that whatever I've said, that despite all our efforts, there is still people, I mean, that 2% of admission rate with infection still does exist. But we try, and I think you have to spend time with your patients. You have to give them a patient hearing. I find a lot of people are being scared by their treating physicians, or are not being given time by their treating physicians. It's very simple. See fewer patients in a day. Okay. We're not everyone likes to earn money, but not at the patient's cost. So, or work harder in a day. If you've got a 5 o'clock golf game set, you don't breeze through an OPD list. You make sure that you get your work done, because like I say to my patients, whoever is sitting in front of me or whoever meets me during daylight hours is not a happy person, because they're not doing it out of choice or the love of me. They're doing it because they have a problem. Okay. So, and I was taught, this is how I was trained, that anyone who's sitting in front of you has left half their brain at the doorstep, because otherwise they'd be sitting in the pub or a restaurant. They wouldn't be sitting in front of you. So try and be empathetic whenever you can. The other thing is, cancer, anybody who's diagnosed with cancer doesn't need sympathy, especially from the doctor. They need empathy. And they certainly don't need to be scared, because they wouldn't, if they're not scared, they wouldn't be sitting in front of you. They've come for answers. They haven't come for you to take them to another horror film. So, you just bat the narrative down, make sure that they understand what they're getting into, because once they do, they don't resist the chemo, they don't resist the radiation, they don't resist the surgery. They all say no at the beginning, and that's a very human reaction. And I get scared when I see people who are numb, who have no questions, because that's somebody's not dealing very well with this problem. And that will come out at some point later, during or after the treatment, and manifest in ways which impact their relationships, which impact their lives to a great degree. So our job is to give patients hope, constant hope, that look, and I tell mine all the time that, listen, it's like being on a merry-go-round. You just fell off like you do as a kid. Me and my team, our job's to patch you up and put you back exactly on the same spot you fell off from, so that you can continue on that merry-go-round. It's not to make your life worse, and it's to keep the the journey ongoing at the same quality of life level or around the same quality of life level that you were at or you met us. So I think communication is key.
Yeah.
And the better you communicate with your patients, the, the more compliant patients you'll have, the happier patients, you'll have patients who end up, because they're happy, because they're compliant, because they trust you, they actually have very few complications. So that's one of the things that needs to be watched every time.
Right, right. And Megha, I wanted to ask you about the how this has affected you psychologically. How has been your mental health in this whole journey, and how are you feeling today? Just kind of going through this journey and getting back to normalcy.
Sure. So, like I said, when I got diagnosed, I was in a great mental space because I perhaps was relieved that something was wrong and I found the reason why it was wrong, right? So, I was in a very good mental space, and that definitely helped cope with the surgery better. Chemo got me down quite a bit. So, I remember the day I told chemo, I told I needed chemo, I was like hit rock bottom. And that took a couple of months of acceptance because I think the one thing I struggle with, everyone's like, oh, be positive, it's just your hair, it's just your career. But for a 25-year-old, it's not just your hair or not just your career, right? I often feel that society kind of rushes you to be positive before you even accept that something bad has happened to you, because it is bad. I mean, there is nothing good that comes out of cancer, right? So that took me a few months to kind of accept, to kind of go through that process of maybe perhaps anger and like just sadness, of whatever, like variety of emotions in dealing with chemotherapy by itself. But over time, once I start realizing that, look, it is manageable and it is something I have to do because I have to like keep the cancer at bay in the future. With that, as the acceptance came again, then there was a milestone to reach. There were like 20 rounds of chemo. So towards the end, it was like, okay, like, like 5 more, 4 more. So there was always something to look forward to because you knew like literally that there was light at the end of that tunnel. So I think that kept me driving through chemo, that, okay, look, I'm going to be done with this in a couple of months. Radiation again were 20 rounds, which is like tick the box and get done. After that, it was about picking up, like life back to normal. It's about regaining strength. So again, that was a good journey, I think, because slowly to be able to go to the cinema for the first time, or to be able to go out and just eat a meal for the first time. So smaller milestones that I perhaps didn't do during chemo, which I was looking forward to, kept me going. So I think a lot of firsts for about a year after I finished radiation. But then once it was all done is when my mental health hit rock bottom, because I guess everyone's around you when the pain is very physical, right? Because, oh, you don't have hair, or you're undergoing chemo, you have the world being with you, because they're like, oh my God, she's gotten a cancer diagnosis. But then slowly you start regaining normalcy, and I think and you've ticked all the boxes, right? You finished chemo, you finished radiation, you kind of regained your strength, and you'll be like, now what? Oh, there is still like routine scans to be done and routine tests to be done. And that's when I think I struggled a bit with my mental health. There were a few other personal factors as well. I lost a family member that also kind of triggered it. But then I've sought help, and the pandemic was again very difficult for me because I was, on account of my health reasons, asked to isolate, and isolation really like took a toll on my mental health. So that's when my mental health, I think, perhaps reached rock bottom in life. But sought the help of a therapist, again, reached out to friends and family for help where I needed it. Found a really good spiritual practice to hold on to. So, whatever rocks your boat. So I think that's what's kept me going. Yeah.
Yeah, it's wonderful that we are normalizing also speaking to psychologists or a therapist, not only for those who have gone through cancer, but all of us. I think that that needs to be normalized. Reaching out to professionals or anyone that you feel can be a sounding board or help you through that journey. Just from a few clinical insights, Dr. Sahni, that I wanted to ask you. And we get this question a lot. Now, if one is doing a self-breast awareness, I like how you said self-breast awareness, then an examination, and does come across a lump. And as you know, lumps are very common with women. Now, how do we define this to be malignant? Does it have to be painful? Is it painless? What's that?
So most breast lumps are painless. They're usually painful if they are related to an infection. And whether it's malignant, I tell everyone, I said, look, if you find a change, come back, because it's not your job to prove whether it's malignant or not. That's mine. That's what I've been trained in, and there's a very objective, methodical way of going about it. And I tell them, I said, look, 9 out of 10 women I see and send for tests won't have it, but everyone has to undergo the same, what we call triple assessment format. Because I said, just like for a raw agent, everyone from across the border might be with the ISI. For me, every breast lump is a cancer unless proven otherwise. And I have to have an exceedingly high index of suspicion, because if I don't, then I will lose a life. So whether a girl is 22 or whether she's 72, when she comes to me with a breast lump or a change in the breast, she undergoes a triple assessment without question. Because
what do you mean? Sorry to cut you. What do you mean by change in the breast? Like what do we look for?
Any change, however subjective it might be. It's just like when all of you go running to your dermatologist saying, "Oh, I've got pigmentation here," and they give you some creams, etc., diagnose it, make sure that it's not skin cancer or anything serious or an infection. It's just like that. Any change, you think that there is a change in the size or shape of the nipple. If you think there you might be feeling a lump. If you think there's pain more than you'd expect, or any pain at all, please go to your doctor, because it's their job. Cancer doesn't present in any one fashion. Okay, it has a range of signs and symptoms that it can present with. So that's why we say any change, however subjective.
I said she was coughing for a while.
Yeah, I mean, she did, and then she found the breast lump itself, so which was a cancer. Now, the cough was basically because cancer lowers your immunity. It's an immune suppressor itself, and it's probably the viral that she caught as a result, which was giving her a constant cough. So it's any change. It's any change. Everyone knows that obviously there's a lump, but there's the discharge from the nipple, and then that discharge need not be bloody. It is when it's a spontaneous nipple discharge without you having pressed the nipple, that's when my alarm bells go crazy. And the color of cancer is usually the color of the shirts that you're wearing in the discharge, or it's the color of water, which is completely transparent. So nipple discharge, lump, if you think you found a lump, then it's up to the doctor to prove the existence and the nature of that lump. It's not yours. You've got to go with the mindset ki, I found a breast cancer and I want it sorted. If you don't have that mindset, and then when I tell women, I said, listen, if you still find a change, don't think that the last time I went to my doctor, he told me that, no, this is a cyst, so it's probably going to be a cyst. That's the trap that you get caught in. So nobody's being a hypochondriac if you even go to the breast clinic 3 times in a year, because you think there's a change. It's, there's no cry wolf story. Yeah, nobody's going to tell you that stop bugging me, because it's the one time that you miss reporting to the medical fraternity that there's probably something sitting out there which is going to give you trouble. And as far as misdiagnosis is concerned, if a doctor is following the classic triad of triple assessment, which is history examination, imaging appropriate for age, and biopsy, okay, you're going to get very few and biopsy also is now an image guided biopsy, so that we know you have got evidence that you've hit the lump, you haven't hit anything, missed it at all. The problem comes with really FNACs, because now we know that they have a very high false negative and a false positive rate. But in places where there isn't the expertise of doing a biopsy, even a well done FNAC can kickstart you at least going to the right doctors from there. So yeah, that's what we need to do.
And does I'm sure there are a lot of women who are going to be watching this, where maybe their mothers or a woman in their family has gone through breast cancer. Now, specifically, let's say their mother or their grandmother or their sister, do they need to take a genetic test?
Good
How
question.
does that work?
So we've got a panel now of tests. It's called the Hereditary Breast Ovarian Cancer Panel. Almost all the genetic or genomics companies offer it, and it's a pretty standardized test. So the rules are that if you've got a strong family history of one or more first-degree relative with this disease, you should, in any case, get the testing done. If you haven't, before you get the cancer. When we get a patient who's under 45, under 50 really, who's come up with a breast cancer, we get everybody tested. And there are certain subtypes that you don't associate with genetics and breast cancer. So by and large, there is a very good concordance between tumor biology and whether you could be predisposed to it or not. But under 50 must. There's no way you can go. But you see, the HBOC panel is only really looking at 2 or maximum 3 actionable genes. We still don't know the value or the significance of the others, but there's a lot of work going on there. So just like we didn't know anything about BRCA till the beginning of this century, and now we know about CHEK2, PALB, all of that. It's coming, but it's coming slowly.
So if you do a genetic test and say you do have a predisposition, what does one do?
That's
it's a scary kind of situation to be in.
A good question, because ideally, if you feel that a patient or a person needs a genetic test, then you need to sit with your clinical geneticist. You need to sit with your counselor. You need to counsel them properly, because there aren't just getting cancer is one of the risks, but what are you going to tell them about what you did, what you need to do? Because it could have ethical, illegal ramifications. It could have personal ramifications. Now look at Angelina Jolie, for example. Yeah, a successful actress at the top of her game. She finds out that this is her family history. She gets a BRCA test done. She's positive for it. So she has to then undergo a double breast removal, which we call mastectomy. And then a year later, I think she was when she got her ovaries and her fallopian tubes removed as well. So that has an impact. Premature menopause has an impact on a woman. The fact that she may not be able to carry on as an actress, she may not fit into the roles that she wants to do. She's done, and it can also, of course, impact your personal life with your partner. So there are a lot of things to take people through before you get the test done. So you've got to have a counselor telling you all of this, because the test is the simplest. Either take a little bit of saliva or draw some blood and do the test. Doing the test is not a problem, and it's now so widely available that it costs max, depending on who you go to, it's under 25,000 for a test, with a turnaround time for between 7 to 20 days, depending on who's doing it. So it's not very costly. It used to be very costly 20 years ago. It's not that costly now. But the ramifications of getting the test done, have to be understood. It's like, why did the COVID during the pandemic time, the RT-PCR test became an absolute nightmare, because the moment you tested positive, you'd be shut down. So during the third wave, which came with Omicron, everybody was getting the RAT, doing it at home and staying at home. Half the numbers that were entered into the record books didn't even exist. So people shy away from this, doing these tests, also because once they understand that double mastectomy, so even people in America have refused to get it done and said, fine, we'll see. We don't want to get the treatment done. So it's a very complicated affair to get into, because sure, you get the test done, you found that you're carrying the gene. Not a lot of women are happy to say, fine, I'll get my breasts removed and I'll get my ovaries done and it's a very serious consequence that we face. So there is work being done on genetic engineering, where people are looking at drugs and methods where they can replace the part in the chromosomes which have been deleted, so that there's no deletion. So BRCA is a deletion in a gene, which doesn't protect your body, doesn't protect your cells from damage, DNA damage. So that's why this problem exists.
Just to wrap it up, Megha, you have been very vocal about your journey. I know that you have a very powerful, wonderful Instagram page, and you speak about all of this so openly. What would you like to tell anyone who watches this video today?
So I think the idea is don't live in the fear. Like Dr. Sani mentioned, be vigilant about your bodies. If you feel something's wrong, go show a doctor and let the doctor do their job. But again, while you hear stories like mine or anybody else's story, don't live in the fear of a diagnosis. The idea is just to be aware and be vigilant and go to the doctor when you feel there is a need. That's all I want to say.
Yeah, I think that your awareness actually essentially saved your life, and that's what people need to kind of really
Yeah.
understand, that it's awareness.
Yeah.
It's just take that step and learn about it. And like Dr. Sani said, it can happen in the most kind of subtle ways, but is so important. Dr. Sani, any kind of last words, and if you would like to ask any questions to each other, please feel free.
No, I'm happy to answer anything that Megha wants to ask me. I think, but she's just hats off to the way you've dealt with it, and congratulations. I'm sure
Thank
you've got
you.
a wonderful career and a great life ahead. But I just like to say that please, this is a disease that is increasing in numbers, whether we like it or not, and you've got to be more aware. Please get your tests done, because in every respect, in terms of us as doctors being able to cure you, to the financial liability, I mean,
Yeah.
you make a case for that is early breast cancer treatment versus a late stage breast cancer treatment, it costs 1/8 of that,
Yeah.
and you're you're a free spirit. Go out and enjoy yourself. You've been cured after all the treatment. So why suffer through the loss of a breast, chemotherapy, potential not being able to cure it? Every woman can get, and any woman can get a breast cancer. So just be breast aware, do your self awareness examination, and go for your yearly mammogram. That's all I have to say.
Thank you so much, Dr. Sani. Thank you, Megha, for sharing your story. Thank you so much for being here today.
Thank you.